Hi, I'm Suhani. I'm your pharmacist intern today. Are you Miss Katibi?
Yes, I am.
Hi, nice to meet you.
Nice to meet you too.
What brings you in here today?
I'm here to pick up my medications that are turned in by my physician.
Okay, yes, I do see that we have a total of three prescriptions or three medications that your doctor prescribed you today. Two of which are for your bacterial infection,
Okay.
and one of which is for your allergic conjunctivitis, which is just dries from your allergies.
Okay.
Okay, so I'm going to talk to you first about your antibiotic because that is the most important. It's called Bactrim DS or trimethoprim sulfamethoxazole. That's just a generic name, but what it is, it's a combination of two antibiotics, so it's a very powerful medication. This is strength of 160 over 800 milligrams. What you're going to do is take this medication by mouth twice daily, and you'll only take it for 3 days. It's a very short course. Okay? So twice daily, what that means is you can take it every 12 hours. So if you choose to take it in the beginning of the day, just pick a good time that you can remember, and then do the same thing 12 hours later at the end of the day. Do that for 3 days. It's very important that even if you start to feel better, that you can complete this course entirely. Otherwise, bacteria can come back and sprout again. We don't want that to happen, okay? Okay, what did your doctor tell you about the benefits of this medication? Or just in general, what did he talk to you about this medication?
I don't remember.
You don't remember? Okay, just a few important things I want to talk to you about. Pretty much this, you have something called UTI, which is just urinary tract infection. So the bacterial infection, which will really help, this medication will really help to get rid of that infection, as well as reduce your symptoms. This medication may not start working till 24 hours later, but and it may take about 5 to 6 days to start having its full effect. So don't be alarmed if you don't see it working right away. It does take some time for that bacteria to go away. However, if say you it's been more than a week and you still aren't feeling any better, that's something that you need to talk to call your doctor and see if maybe he can prescribe you another medication that can help with the symptoms and the infection. What questions do you have for me so far?
Nothing.
Okay. All right, so this medication does have a couple of common side effects that you should be aware of, one of which is diarrhea. And diarrhea is something very common with antibiotics, but nothing to be alarmed for unless you see something more serious like blood in the stool, or if it's too much diarrhea for a very long time. That's when you need to stop the medication and once again seek medical advice or your doctor for that, okay? Store this medication at room temperature in a dry place. Do not store it in the bathroom because that's where the moisture can build up when you're like showering. So avoid that and keep it away from the light. Okay? Do you know if you are allergic to any component of this medication, such as the two ingredients that I stated with trimethoprim or sulfamethoxazole?
I never had allergic reaction before.
Okay. The reason I ask is because sulfa is a common common allergy. Very many people that get exposed to that develop rashes or have trouble breathing, and that's a serious allergic reaction. That's when you need to stop taking the medication. So just be aware of that while you're taking the course of this medication, okay? And I did look at your file, and it looks like you're not on any other medications. But do you know if you're taking anything else besides these three that we should be aware about?
No, I don't.
Okay. The reason I say that is because this medication does have some can be interacting with some drugs, and it's really important that if you start to take any other new medications, inform your doctor about it.
Okay.
That way we can prevent any sort of side effects with those two drug interactions. Okay, and those were the important things about this medication. There's no refills, so once you're done with it, you won't have to have an additional refill unless unless your symptoms are lower and doctor says otherwise. And our contact information is provided here
Okay.
in case you do have any questions about this one. And if it's okay, I'm gonna continue with the next medication.
Mm-hmm.
This one is also for urinary tract infection, but it's not used to treat the infection. It's actually used to help with the pain associated with the infection. So this is a urinary tract analgesic. The analgesic just stands for pain relieving. So this medication will work a lot more fast than the previous one. You should start to feel the effects within a day. This medication, you take 2 tablets by mouth 3 times a day. So you space it out every 8 hours, okay? And you choose the perfect time of day, you can remember it and take it then. And you can take this with the meal or you can take it after a meal. Okay? And that's, if you have stomach upset, that's really good to help with that. And just take it with a full glass of water.
Okay.
Okay, and a couple of things that you should be aware of as far as side effects go. This medication can cause something, it's a reddish orangish discoloration of the urine, and that's common, but if it happens for more than 2 days, then you need to stop this medication because that could be a serious side effect, and talk to your doctor about maybe something else that he could suggest. Okay, what questions do you have for me so far?
Nothing.
Can you tell me what to watch out for if for just a common side effect for azo?
You mentioned something about the discoloration of the urine, right?
Yes, yes. And actually, I'm sorry, I didn't even tell you the name of this drug. It's called azo. Phenazopyridine hydrochloride is the generic name for it. And yes, and you're correct. That's the common side effect for it. And that's, you just want to store this like the previous one in a dry place away from the light. Okay.
Okay.
If you don't have any questions on this one, I'm going to continue with the last medication.
Mm-hmm.
This one is for your allergic conjunctivitis, which is just your seasonal allergy. And do you experience watery or dryness of the eye or itchiness?
I have dryness.
Dryness. Okay, so this medication is definitely good for that. It's called Pataday, or generic name is olopatadine, and it has a 0.2%. It's an ophthalmic solution. So it's a liquid form. It's used for the eyes only. Okay. So the way this, you're going to start to experience the benefits of this medication within 30 minutes. Okay. So, did your doctor tell you about how to use this medication exactly?
I just know he prescribed me an eye drop. That's all I know.
Okay, not a problem. I'm just gonna walk it through with you just so you know how to use it. So what you can do if you have glasses or contacts, you're gonna take them off. Okay, make sure you wash your hands with soap and water effectively, and then what you want to do is you can lie down or you can tilt your head up like this. Okay. Then you'll take with your index finger, pull down your lower lid like this. Okay. And what's important that you have the cap off before you instill it. So once you have the cap off, you'll gently squeeze 1 drop into the pocket of your eye like this. Okay. And you'll have it sitting there. You close your eyes and just press the finger of your inner eye like this, and have that sitting there for about 1 to 2 minutes, just so your eye can really absorb it. Okay. You do the same thing with the other eye. Okay. And don't tip the dropper or let it touch your eye, because that can contaminate it. You don't want any sort of infection in your eye. Okay. You just close it right back and just make sure it's tightly closed, away from sunlight, in a dry place, just like the other medications. Do you have what questions do you have for me so far?
Nothing.
Nothing so far? Okay. With this medication, it's a lot more safe, and when if you're taking like any sort of other medications or foods, there's no interactions with this. It's a completely safe drug to take, and you don't have to be aware of any interactions with that. Okay, and I have hit all the high points with these medications. I wanted to ask you, how often are you taking this medication?
Once a day.
You're taking it once a day, and you'll place it each eye just once.
Okay.
Okay? All right, if you don't have any further questions, my contact information is right here, and I want to make sure that we have your contact information up to date. Is that correct?
Yes.
Okay. All right, well, I hope you do feel better, Ms. Smith. Good to meet you.
Good to meet you too. Thank you so much.
No problem.